This one is for my public health friends. Let's talk about how healthcare is funded in Nigeria. We know that one of the main things we need to achieve in public health is equity, especially when we talk about the management. So affordability of healthcare services is very important to us. We know that there are different actors interested in funding healthcare. But just to clarify, let me list the four major ones. The first one being the government, second one being insurance companies, thirdly being individuals, and lastly we have donors. But today we're going to be focusing on the public funding of healthcare. So the Nigerian government has two primary ways. The first one is through our annual budget, and that is primarily powered by the taxes of Nigerians. So we have allocations like maybe 8%, 10%, year in and year out, that the government is going to say goes to healthcare, and this is usually used for different purposes depending on the interest of that government. However, we have this fund called the Basic Healthcare Provision Fund, which focuses on primary healthcare delivery in Nigeria. And I think this is the interesting part of the conversation where we really need to get our way on. So this fund is generated from 1% of the consolidated revenue fund. And when we talk about consolidated revenue funds, there's been argument as to what's the definition. Is it 1% of what federal government's revenue? Is it 1% of their expenses, or is it 1% of their budget? Well, let's talk about that in another video, but we take it as 1% of the CRF. So there are three major gateways and this money is disbursed. The first one is the National Primary Healthcare Development Authority gateway, which is responsible for about 45% of the total funds. Then we have what's called the National Health Insurance Scheme, and this is our popular NHIS, taking up about 55% of the fund. And then we have the National Emergency Medical Treatment, which takes up about 5% of the fund. So let's zoom in on the National Health Insurance Scheme. The primary goal of this fund is to provide basic minimum health package, which is disbursed through state social health insurance schemes. And what this money is meant for is to ensure that everybody have access to basic things like vaccines at primary care centers, essential medications, delivery of consumable services. And then let's now go on to the first gateway, which I mentioned, which is the National Primary Healthcare Development Authority. So many factors are involved in healthcare. We have the human resource, we have the service delivery, we have the patient side, and we have a lot of administrative. So this one from the National Primary Healthcare Development Agency focuses on ensuring that the primary healthcare center keeps working. So that money can be used for things like human resource recruitment. It can also be used for maintaining the building and facilities. It's mainly committed to operations of the PHC, and this is the impact that this fund has. Imagine a PHC that is still waiting for budgetary allocations, and where every of that small expenses must come from the government. I know PHCs nowadays, people don't want to pay because honestly, people should not be paying. So this fund has ensured that the PHC can get regular disbursements irrespective of their state government or the federal government's allocation, because this fund is independent of politics. Right, and then let's take hypothetical figures now. Let's take 1 billion naira. Imagine how much we'll be getting to one PHC. Let's say as of last year, about 150,000 naira every month. So with that 150,000, the PHC can employ at least one community health extension worker, and the PHC can also do basic, water supply, electricity, and other things that needs to be done. So this fund is very, very essential for our PHCs, and I'm looking forward to that time where we'll go to one village like this and we see that they are working. Yes, there is fund to keep it operational and efficient. Now let's zoom in on the last gateway, right? It is the National Emergency Medical Treatment. This fund is mainly for ambulatory services. Now, public health people, and in fact the general public, let me ask you, if you are in an emergency, how many of you are likely to call the number of an hospital, more so a public hospital? But you know that if it is in the US, the first thing you call is 911. So let's just say this money is meant for building the 911 system of healthcare in Nigeria. And has it been efficient so far? Well, we have a lot of ways to go in terms of implementation, right? And we have seen public-private partnerships happening with this money. So it means that we are on the right track. And as public health, it's now in our hands to make sure that we support in terms of policy, implementation as private actors, as social actors, to making sure that primary healthcare in Nigeria is free and every other form of healthcare in Nigeria is better. We really don't want our people to keep having to pay like 70% of the money they spend on healthcare. That can be very catastrophic, right? So now that you know how public primary healthcare is funded, what else would you like me to explain about healthcare financing, policies, and management in Nigeria, Africa, and globally? Let me know in the comment section. My name is Momile Idaresi Obinchemite, and I'm the Global Village Girl. Follow me for more videos on social entrepreneurship, healthcare, leadership, youth development, and important tips for your career growth. Thank you, and see you in my next video. Bye.